So this is a strong area of interest for me, and I think there are some late effect sparing benefits that are pretty obvious. So for example, in a patient who's having spinal radiation, in a young person who needs the entire spine radiated, when you use X-ray therapy, there's nothing you can do to prevent, the exit dose to the visceral organs. And in a child, eliminating that can eliminate their secondary breast cancer risk, can eliminate infertility risk, can spare them procedures that we may have done before to try to spare fertility. We used to try to move ovaries around and take pieces of ovaries to, cryopreserve when we only had X-ray therapy. Now we don't have to do that for anybody. So it spares them procedures. It spares them, any risk of complication in their other visceral organs like the bowel, which are maybe somewhat less described, but certainly exist in the literature in the older populations of patients. When we're thinking about patients with brain tumors, our ability to spare, potentially half of the cortex or other elegant structures hopefully allows the neurons in the non-radiated parts of the brain to compensate a bit for the areas that are inherently damaged by the presence of a tumor.